For this video, we're going to talk about angina and myocardial infarction. So when I talk about angina, this is chest pain, and there's two types. There's stable and then there's unstable. And then it kind of progresses onto myocardial infarction. So it's almost like a spectrum. So when we talk about stable angina, this is, you have chest pain occasionally while you're at doing activity or exercise or during times of stress. And it is relieved by rest or by taking a nitro, and it's typically not that bad. Unstable angina is when you have that pain with activity or stress, or sometimes it happens without activity or stress, but it's with more frequent and it becomes more severe and it lasts longer, but it's still relieved with nitro or with rest. Myocardial infarction, however, is when you have that angina, that chest pain, however, you take nitro and rest and it is not going away, and you have other symptoms such as nausea, vomiting, and diaphoresis. And so it's that chest pain plus more and it won't go away. So, what are the risk factors for angina and for myocardial infarction? Hypertension, typical for coronary artery disease. Hyperlipidemia and diabetes, because that's increased triglycerides causing plaques around the heart. Smoking also increases your risk for those plaques, and it also closes the vessels and makes it tighter. Hyperthyroidism, just because it's going to have the heart beating more, and so it increases your heart's need for oxygen. Use of methamphetamines or cocaine also make your heart beat extra. And stress also increases your heart's demand. So what are signs and symptoms? I told you got the chest pain. This chest pain can radiate to the shoulder, the arm, or even jaw pain. And it can feel like an elephant sitting on your chest, lots of pressure. You also can experience nausea and vomiting, breaking out into sweats, some dizziness because you're having poor cardiac output because your heart's, if you have a heart attack, your heart isn't working like it should. That dizziness can eventually lead to changes in level of consciousness. And your decreased cardiac output could also lead to cool, clammy skin with paleness. Also, some associated problems that can develop from myocardial infarction that you might start seeing would be dysrhythmias. The patient may go into heart failure and develop pulmonary edema, or go into cardiogenic shock. So what are some labs that can tell you, hey, this is a myocardial infarction? What you'll see is an increase in cardiac enzymes, myoglobin, troponin, and creatinine kinase NB. Also, you'll do an EKG and you'll see some changes on the EKG. There's also, I told you the labs that you can do. Sometimes they'll do a stress test, which could be either a physical or a chemical stress test, and they'll do this with cardiac monitor on you so they can see, you might not be in pain at the right then, and while you're doing the test you may develop the pain, and they can see, oh wait, here, this isn't just angina, this is actually an MI, we need to do something about it now. Also, they can do an angiogram in which they'll go in and look at the vessels themselves. So once you know someone's actually in myocardial infarction, first thing you want to do is put some oxygen on them so their blood has as much oxygen as possible to supply the heart. You want to give them a nitro. This is going to open up those blood vessels and allow blood through those clotted arteries. Aspirin and Plavix are going to prevent further clots from developing. Giving them morphine is going to help with anxiety. It's going to vasodilate those vessels, and it's going to help with pain. Giving them beta blockers is going to help the heart to beat more effectively and also open up the vessels. And they may need to do thrombolytics, such as streptokinase or activase, and now actually break up the clot that is causing the heart attack. And so with these medications, you want to be sure to actually watch for signs of bleeding, and you definitely don't want to give them if someone has a history of like a bleeding stroke or GI bleed. So if these are ineffective, the patient may need surgery, and they may want to do a percutaneous transluminal coronary angioplasty to place stents. And what stents are is they're going to set a tube in there that's going to open up those blood vessels and keep them open so that the clot is no longer closing off the vessel. Or they can do a CABG, which is a coronary artery bypass graft. They'll take arteries from the legs, put it into the heart so they have big open arteries to supply the heart with blood. And so that's the difference between angina and myocardial infarction and some of the treatment. Also, a quick mnemonic to remember from MI treatment is MONA, M-O-N-A, and what this stands for is morphine, O2, nitro, and aspirin.